Good evening, everyone, and thank you for coming. I know time is valuable. I know many of us are completely maxing out on Zoom, so I appreciate it all the more. But then I just have to assume that you have allergies and are looking for some support, and I would like to offer that to you. I'm Dr. Miranda Wiley. I'm a naturopathic physician practicing in Vancouver. I am at Cena Pharmacy right here and now. We're at Smythe and Richards. And yeah, so we'll get started without any further ado. A little bit about me, keeping it brief. Eternal student. I am terrible at saying I don't know. I can get as far as I don't know yet. I'll look that up. I'll figure it out. I'll find an answer if I can. Started out in a health food store when I was 13 years old, back when there wasn't internet and I had to go to the library to answer people's questions and look on a microfiche. And still, I always wanted to know. I want to know why. I want to know the answers. I have two small kids. They keep me busy. They are actually my full-time job. This is more the fun hobby that pays a little bit. And then a whole food foodie. My happy place is in the kitchen with a pile of vegetables and whole ingredients and making stuff for my littles and my family. Today, we're going to go over a little bit about the immune system so that we understand what we're talking about when we discuss allergies and the allergic response. I will introduce naturopathic medicine to those of you who might not be familiar with what we do as NDs and what our guiding principles are when treating patients and looking at the whole person. And again, very specific with its approach to allergies. And then we'll look at some options for the allergy sufferers on March 2nd as we, look at all the beautiful buds coming out. Overview of the immune system. It's a scale, it's a balance. It's constantly being introduced to compounds in the world, some of which are toxic, some of which are benign, and it needs to make that decision. Does it need to respond, or can it just let that one slide? Is there something that it needs to clean up in the system? So when we have a balanced immune system, we're going to have an appropriate response to illness that will help us survive the illness and get to the other side, an appropriate response to allergens and pollens and food particles where we don't go overboard. If our immune system is overactive, then when we're looking at internal threats, that's when we can start getting autoimmune conditions. So the body, in its confusion or through misinformation, starts to attack the thyroid, the joints, the digestive lining, the pancreas, and we end up with our autoimmune damaged issues. When we have an underactive internal immune system, that's when we end up with all these diseases that don't get nipped in the bud. Our cells are constantly turning over. DNA is being divided, multiplied, goes into the separate cells. And our cells are human, and so they make mistakes. And it's the immune system's job to say, oh, wait a minute, you did that wrong. We're just going to delete that cell so it doesn't go rogue and become cancerous. So we don't end up with shingles or these latent viruses that can then cause problems. And when we have an underactive immune system reacting to the outside world, that's when we become particularly ill with infections, bacteria, molds, fungus, parasites, athlete's foot. We're getting sick all the time. It is appropriate to get ill once or twice a year, unless you are exposed to small children, either through parenting or through your career. Where we're going to focus is when we have an overactive response to external threats. So foods that are coming into our system, pollens that we're being exposed to, the immune system goes overboard. Oh my goodness, it's a cat. Let's just shut down those nasal passages and make everything hyper-inflammatory. Oh dear, we come into contact with some laundry soap we don't like big red rashy patches on the skin. Asthma, same thing. So we want to keep our immune system in balance with both internal and external threats. When we look at the allergic response pathway, I'm gonna have to ask you guys to bear with me and my poor PowerPoint skills, but we have this initial contact between an allergen and an antigen, or an allergen or an antigen, with our B cells. This is one of the cells into our immune system. It's a white blood cell, and the antigen comes into it. Sorry, I got more people in the waiting room, admitting them in. There we go. Hello, welcome. This has been recorded, so we can always go back and catch up on anything you've missed. We're doing an overview of the immune system. An antigen or an allergen, something that is floating around in our environment, comes into our system, makes contact with a B cell, a white blood cell, and then that causes that B cell to differentiate into a plasma cell, a specific type of B cell that produces antibodies. So when you feel that swelling in your tonsils and you know that an illness is coming on, it has swollen up because all those plasma cells are pumping out thousands of antibodies against that particular virus that you've encountered, so that we can flood the system and get over that cold or flu faster and more effectively. It then puts out those antibodies. They're normally Y-shaped, but I couldn't figure out how to do Y-shapes. So mine are thumbtack shaped. And we have these antibodies that are going to float around the immune system or float around our bloodstream. And it will come into contact with a mast cell. The mast cells are throughout our system, generally just under the surface of the exterior. So underneath our skin, along the bronchial tree, our digestive tract, so in just a little ways, and they contain histamine. So they are holding it. And when we have good, strong, stable mast cells, the histamine stays within. When we have twitchy, hyperreactive mast cells, then the histamine is going to come out. So we have that antibody connecting to a mast cell, and it's educating that mast cell that there's this antibody to this potential allergen. Be on the lookout. You might come into contact with it again someday. Sure enough, time goes by, that we breathe in that pollen again, we go pet another cat or a dog, and it comes into contact with that antibody attached to the mast cell, and hey presto, histamine is being released out into the system. Normal response. Histamine is a vasoactive peptide. It is protein-based, and it has activities on our vasculature, on our blood vessels. One of the things it does, it leads to swelling, get that redness, the flushing, and therefore it will decrease our blood pressure. Because if we have expansion in our blood vessels, there's less volume for all of that to happen. So in a really bad case, that's your anaphylactic shock. So much histamine, so much dilation of the blood vessels, not enough blood pressure to feed the heart and the blood and the brain. It also constricts bronchial tissue. This is where we get into the asthmatic attack, everything being a bit tighter, the wheezing, the difficulty breathing, and it increases stomach acid production. So histamine is also a target for some people with digestive issues. Antihistamines work. They block. The histamine is floating around the bloodstream, and it is blocking those histamine receptors. Therefore, we're not going to have that dilation of the blood vessels, the constriction of the bronchial tissue. You can breathe more freely. You're not going to feel as itchy, as irritated, and the system goes well. Absolutely, they work. What's the saying? You're closing the gate after the horse has bolted, though. If we can get upstream of this immune response, if we can delay or lower the amount of histamine being released in the first place, then we're in a much better stance. We can still use those antihistamines as needed, but we don't need to rely on them to try and stop that last stage of the immune response when we're faced with an allergen. So our 6 principles of naturopathic medicine, which guide what I do and what my colleagues do, and we learn right from, I think, the second day, somewhere in the first week of school. First, do no harm. This is common to all medical professionals. Don't make your patient worse. We want the healing power of nature, which we believe to be twofold. On the one hand, nature supplies an amazing abundance of tools and herbs and nutrients and things that we can use in order to help support the body. But it also, we believe that the body is inherently trying to constantly heal itself. And if it is not, then there's either something blocking that healing process that needs to be removed, or there's something missing that needs to be added. But we believe the body is willing and able to heal itself if given the right tools and time. We want to treat the whole person. The classic is, someone might come in with palpitations. It could be a cardiovascular issue. It might be that they have a thyroid issue. It might be that they're low in iron and it's an anemia thing. So there's we don't want to look at each symptom individually, but what is that telling us about this entire person in front of me? Treat the root cause. So actually get to why that person is out of balance in the first place. So if someone is anemic, low iron, it's very easy to treat. You give them iron. But why are they anemic? Are they not getting enough iron in their diet? Let's discuss what they eat. Are they not digesting it well? There's plenty in the food, but it's not crossing the digestive membrane and getting into the bloodstream where it can then, go to the hemoglobin and actually nourish the cells? Or are they losing too much blood? Are they have digestive issues? Are we looking at heavy menstrual cycles? So we want to get to that root cause. Doctor is teacher. Doctor comes from the Latin word docere, which means teacher. It is my job to explain things to patients because they're the ones actually doing the work. I'm more the tour guide saying, this is what I think is going on in your body. You need to do X, Y, Z. And then whether they do it or not, that's up to them. But hopefully I can educate them well on why I think it's important that they drink more water or eat 3 times a day or whatever that may be. And then prevention, particularly I think in today's world, this is really important. We have a burdened healthcare system. And if we can minimize the number of people getting type 2 diabetes or having high cholesterol or high blood pressure through diet and lifestyle and more natural interventions, that opens up hospital space for those who really need it for emergencies or genetic illnesses or things that are less readily controlled. So first, do no harm. Again, pretty basic. Let's not hurt our patients. Antihistamines are not dangerous. However, they can make people drowsy. So if you have a job where you operate a forklift or heavy machinery or you're responsible for airplanes not smashing in the air, you don't want to have that drowsiness. So there's times when we want to be more mindful of using antihistamines. I have some people who just don't like them because they don't want to be drowsy all day. So it can be a bit of a trade-off. They'd rather be itchy than drowsy. Some people are fine being drowsy as long as it takes away the congestion. So find that. But for most people, they're fine. We want to dig a little deeper. For the healing power of nature, there are a lot of options. Vitamin C helps to stabilize the mast cells, as do bioflavonoids, particularly quercetin. And these are compounds that are found with vitamin C in food. Quercetin, it's in the brown onion skins. So if you're making your big soup stock, throw in the whole onion, throw in the skins as well, and make it a little bit more quercetin rich. Rutin is found in fruits and vegetables as well, as is the hesperidin. And they also help to stabilize that mast cell. So if it's a little bit less twitchy and reactive, that should mean less histamine coming out into the system and therefore fewer symptoms in the first place. Vitamin D, great for modulating the immune system. So we have that scale balance of overactive and underactive. Vitamin D helps to find that tone and that middle ground. So it's not just going to ramp things up and we could end up with excessive response. It's not going to mute everything down, more of that balancing effect. Omega-3 fatty acids, commonly from fish oil. There are some vegan ones out there now that are coming from algae. I don't know why I'm doing this. They are actually vegan. They're non-animal product, but a vegan fish. And they have been shown to have a really positive effect on regulating the immune system as well. So reducing inflammation, which histamine causes, and normalizing the immune response to allergens. It has been shown that women who consume sufficient amount of omega-3 fatty acids while pregnant have children who have less allergies, especially when they track them up to age 6 years old. So this is great. You get a baby with less eczema, less tendency towards asthma. So, good research there. Nettle leaf, this is a herb that has been used for centuries, if not possibly millennia, to treat allergy symptoms. And if you have ever been stung by a nettle, and now is the season where they're coming out, you get that ouchy, red histamine sting, that reaction. It's causing that response in your system. So with a tea where it's been, it's not as volatile, we're not getting that same antigen response, but it can be just that low grade amount that the body responds to, potentially, or it's just that it's so nutrient rich. It could have other elements in helping to balance out immune function. That has been used for ages. Eye bright is a herb that helps us sort of clear eyes. It looks like an eye. It has a blue center with white on the outside, and it's really great for that streaming, running nose. So with the herbs, you might get them as a tea, you might get them as a tincture, you might get them as a capsule. This is where I like to make it more individual with patients and see, well, what do you really need? How are you experiencing your allergies? Are you runny? Are you congested? Are you itchy? Are you watery? Is it skin? Is it lungs? Is it nasal passages? What's happening with you? Bifidobacteria. So the lactobacilli, so part of that friendly microbiome of bacteria, they help to ferment the foods that we eat and make them more available, digesting them for us. And in doing so, they will often produce histamine. Histamine comes from the amino acid histidine. Through fermentation, it becomes histamine. So we can produce more histamine in our gut. So for some people, we're looking at their digestive tract. Bifidobacteria, as a general rule, help to break down histamine. So there's a number of things we can do, many other options. And again, really making it specific to that individual, what they're experiencing, and how we can tailor it to their best interests. Treating the whole person. So with allergy management, we're looking at getting down to the root of supporting that immune system. And the immune system is multifaceted. It is connected to the digestive tract. You may have heard that 70 to 80% of our immune system lies along our digestive tract. Certainly the immune system is on the exterior of our body, but where I have skin, there's layers and layers of epidermis blocking any potential exposure to the allergens. It's really only if something pokes through, like a bee sting, or if there's a wound or something that's really kind of irritating that dry skin. It's along the bronchial tree. We have lymphatic tissue and immune cells there. But again, there's layers. We're thicker there. Along our digestive tract, along the small intestine, we can be as thin as 1 cell thick. 1 cell is a very thin membrane between us and our inner workings, our DNA, our blood, our lymphatic system, our organs, the vulnerable parts of us, and the external environment, the food we eat, the nutrients we take in, any medications, our microbiome, just 1 cell thick. So we have to concentrate our immune system along patches of our small intestine, primarily, a large intestine as well, in order to protect us, because that's where the slightest little lesion or irritation could wreak havoc. So supporting the digestive tract can be really key in supporting the immune system. I had one patient a couple of years ago. He woke up every morning and sneezed and sneezed and sneezed, sneezed and sneezed and sneezed. We worked on the allergies. There was some improvement. It was great. Came back a few months later and he's like, still congested in the morning. Like, it's better, but we're not done. And we started talking about how if he ate certain foods, he'd feel really like nauseous and bloated and, maybe burp a bit. I'm like, well, let's work on your digestive tract. We started treating his digestive tract, all the morning sneezing, all the morning symptoms went away entirely. So we'd made some progress, but it wasn't until we addressed the digestive tract piece that we really boom, I haven't seen him in a while, which is a good thing. Diet and nutrition. Some foods are naturally high in histamine, and some foods help to trigger our body's histamine release, maybe by irritating those mast cells. But I remember being a little kid, we went strawberry picking with my best friend, and we all went out into the, pick your own buckets and buckets of strawberries. And we're in the back of the car mowing down. My parents like, careful, careful, you might get hives. And sure enough, berries can be naturally high histamine. Eggplant, there's a number of foods out there. So if you're already on that tightrope, eating some of those foods might put you into a more full-blown histamine response. Hormone balance, we regulate our own inflammation using adrenal hormones. If you've got eczema, you're probably going to get a cortisone cream at some point. If you have asthma, you might get a cortisone puffer. We produce our own cortisol through our adrenals. So that might be something to look at. If we have rampant inflammation and we're not maintaining it ourselves, maybe we need to look at stress levels, that person's cortisol levels, and find some balance there. And then the nervous system, it's bringing in information the whole time. When we're under stress, allergy symptoms are often worse. So that can also tie into that hormone balance and that adrenal piece. But really, we're just kind of looking at that whole person and not just being like, here's something for the allergies, here's something for histamine. What else is going on with this individual that might be factoring in, even if it's 20% here, 30% there, 10% here, 40% there, we can make progress. Treating the root cause. So this is, I think it would be a little bit more the crux of what I want to talk about now would be immunotherapy. Allergy immunotherapy is essentially retraining the immune system to see antigens as non-threatening agents. It takes time. We are teaching a system that is primed to react. You have, your well-trained professionals of any nature. I want to say soldiers, except this seems like really the wrong time in the world to be saying that, but like soldiers, they're trained to do what they do, and to train them to do otherwise is going to take a lot of conditioning, a lot of work. And yet, if we can retrain the immune system to see that antigen and not over respond to it, just be like, yeah, there's cat dander. All right, no big deal. I can respond to this. Then all the better. So immunotherapy can be done a number of ways. I'm going to go here still. So there are two main ways. One is subcutaneous immunotherapy, which some people are familiar with as allergy shots. So you're taking what that person is allergic to. So a small amount of dog hair, a small amount of dust mite, and just doing a little bleb under the skin. So just going into that subdermal area, and it's bringing in that antigen at a very, very low level, so it doesn't mount an immune response. And then a week later, that person goes back, they get another shot. A week later, another shot. It works, but it takes years. It can also be done under the tongue, sublingually. So there's subcutaneous or skit, and there's sublingual or slit. We're going to talk about slit because I find it so incredibly effective, and it's kind of near and dear to my heart. The testing is done in-house. I do 5 points up the arm and do one test on either side. So it's 10 different antigens. On one side going down the arm, it's the positive control. So this is a little bit of histamine being dropped onto your skin. And then if I hold this up to the camera, how can I get it so it shows well? It's just a little piece of plastic with 2 little prongs on it. It's not a needle, but it's just a bit to kind of poke that antigen under the skin. So with histamine, I'm expecting a response. I want to see a hive. Then following the letter P down the arm, a combination of 5 grass pollens, 2 ragweed pollens, 6 weed pollens, 10 tree pollens, so boop, 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 boop. Then down the negative side or the other side, a negative control to begin with. This is glycerin. It's the base of all of these. So if someone responds to that, I need to interpret their results a bit differently. And I've only had 2 people in the last 10 years where I've had a hive come from the negative control. So if it was just 1 millimeter with the first guy, and I was like, I've never seen this before. I just subtracted that from, the 10 millimeters that he had for grass pollen or whatever it was. And then just alphabetically with living organism fauna, the cat, the dog, the dust mites, and the moulds. So living things down the side. Plants are living things as well, but you know what I mean, animate things. And then we wait about 15 minutes, we see what kind of hive that person develops. I can measure it with this handy dandy little thing with these different size circles that tells me the millimeters. And then I can just see how big a response that is. After about 15 minutes, the welts do start to go down. The person might be itchy. I have Benadryl on hand. I will give you Benadryl as you leave the door. Some people are totally fine with it. Like, no, they take pictures, post to their social media. Look, I am allergic to summer, as one of my patients was. It was just everything down this side, everything flora-based. And so you'll get your vial. It'll be customized for you. And you do, 1 drop in the morning. The next day you're doing 2 drops in the mornings. I'll walk you through that as we figure out what you need. Everything comes with pros and cons. The pros is that it's easy to use. You are doing it at home. You don't have to go for an appointment. It's a drop under the tongue, 2 drops, 3 drops. Your maintenance dose is 4 drops. It has a very good safety profile. The World Allergy Organization recognizes both forms of immunotherapy and is happy with both. So it's well studied. It's often covered by insurance, which is a boon for some people because then it means that it's the less expensive option. It, as a con, is expensive, so that is not covered by your insurance. That can be a deterrent for some people. It's about $100 to $125 a month. But if insurance is covering that, or 80 or 90% of that, then some people are like, well, that's cheaper than buying Reactin all month. So this can be a pro or a con depending on your current insurance level. Because it is in the background, teaching the immune system, no need to over-respond. It's just a grass, no big deal, calm down. You can still do an antihistamine up front. You can still treat the symptoms that you're experiencing while the slit takes its hold and does its job. And there's no needles involved. So great for kids or people who are just needle phobic or just don't have time to go make an appointment and go once a week and sit in the waiting room. And then certainly that's been a bigger obstacle in the last few years. Cons, as I said, it can be expensive. It takes time. We're talking 3 to 5 years to desensitize the immune system. So, it's a commitment. Hopefully, if you start it this year, next year, symptoms are better. Maybe you're doing regular strength antihistamines as opposed to extra strength. The year after that, maybe you just need it, during the key months, but not the entire summer all year round. And no safety profile is perfect. In the US, to do sublingual immunotherapy, people do still have to carry around an EpiPen. If they're on this treatment, that is not a requirement in Canada. However, I do think it is good. It's nice to have added safety at any point when you have an over-responsive immune system. Doctor is teacher. So whether it's to do Eyebright or to take quercetin, what dose, how many times a day, whether we're going to be looking at the gut and cleaning that up as a means of getting on top of histamine response and the allergy. I mean, that's my job, to take all that information, distill it down, because it's what I love to learn about. I don't know how my phone works. I don't know how my car works, but I love the medicine and the body and how that all puts together, and try and make that as comprehensive for the patient to say, like, yes, I'd like to try this one, maybe not that one. I'm not ready for this now. What would be involved here? And come up with the best plan for the individual. And then prevention. I prescribe HEPA filters a lot. So if that's your one takeaway from today, London Drugs, Home Depot, Canadian Tire, Walmart, Amazon, there are so many HEPA filters out there. There are small ones that will do, 100 square feet or whatever the size room is. Bigger ones, they'll do 1,000 square feet to your whole home. So you get what you need based on the size that you want. At the very least, I recommend them in the bedroom while sleeping. So for those 7 to 10 hours that you're in your room at night, resting, healing, restoring your body for the next day, you've filtered out all of the allergens in the air and you're cleaning up. So your body really can heal overnight. HEPA filter is very, very common prescription. Face masks. These have been studied for years as a great way of filtering out antigens and pollens and allergens from the atmosphere. But up until 2 years ago, no one wanted to walk down the street in spring and summer wearing a mask because that might look weird. And, this summer we might be phasing out of that again. We'll see. But there's a window for allergy sufferers where they can comfortably walk down the street now wearing a mask. Most of the masks that are available, here's my cloth one, whoop, or even an N95, whoop. These ones, they are designed to block out viruses that are 0.1 microns in size. Most pollens are 10 microns, so 100 times bigger. You just want to make sure it has a really good seal, a good fit, or you might want to get one with the respirator. But potential option there that was more awkward 3 years ago and before that. Immune modulation support, number of options there. We might do a more broad spectrum, looking at what's happening with the immune system, again, herbs, nutrients. And that's where, having an hour as an initial visit to discuss, like, what's going on? What do you eat? How do you sleep? What's your stress levels like? How do you cope with stress? Meditation might be something that just helps to bring down that allergy response. Although that can be a pretty tough sell for some people. Sublingual immunotherapy. So again, we're preventing it down the road. It becomes easier over time. You just have to talk to your insurance company and see whether it's a viable option for you, if it's something that interests you. So leaving on some cute kitties, 6:30 right on the nose. I want to thank you all for joining me this evening. I do welcome questions. If you don't have my email, it's hello@drmirandawiley.com, or you can find my website, or you can call Sina. It's internet. We're all out there. But I'd love to hear your questions. I do see some things in the chat. Here we go. Someone who has already done some sublingual and only did grass, and it took 2 years, but open to maybe considering it for the rest of the allergies. So yeah, it takes some time, but when you get to the other side, you've got summer back. You can now, maybe have a picnic on the grass and not avoid barbecues because someone just mowed their lawn before you got there. So thank you all. Let me know if you have any questions, and stay well, be happy.